Hi, now let's move to the depth of anesthesia. The depth of anesthesia is a crucial aspect of anesthesia management as it determines the level of unconsciousness and analgesia necessary for a patient undergoing a surgical or diagnostic procedure. Achieving the appropriate level of anesthesia depth is essential to ensure the patient's safety and comfort during the procedure and to facilitate a successful outcome. There are four physiologic stages of general anesthesia, and the depth of anesthesia has four sequential stages characterized by increasing CNS depression as the anesthetic accumulates in the brain. For stage 1, analgesia, the person will loss of pain sensation, which is results from interference with sensory transmission in the spinothalamic tract. The patient progresses from conscious and conversational to drowsy. Amnesia and reduced awareness of pain occur at stage 2 is approached. Stage 2, or also known as excitement stage. The patient displays delirium and possibly combative behavior. Arise and irregularity in blood pressure and respiration occur, as well as risk of laryngospasm. In stage 3, a person will experience a gradual loss of muscle tone and reflexes as the CNS is further depressed. Regular respiration and relaxation of skeletal muscles with eventual loss of spontaneous movement occur. This is the ideal stage for surgery. And careful monitoring is needed to prevent undesired progression to the stage 4. In stage 4, severe depression of respiratory and vasomotor centers occurs. Ventilation and or circulation must be supported to prevent death. Let's move to the general properties of an ideal general anesthetics. First, the general anesthetics must give high degree of analgesia, immobility, and muscle relaxation at minimal dosage required to produce loss of consciousness. Secondly, it must have rapid onset of action without causing involuntary or voluntary struggling. Its administration should be easy, comfortable, and versatile. It do not cause undesirable systemic effects like hypotension, arrhythmia, respiratory depression, or renal damage. Have short recovery period with no after effects, potent, non-inflammable and non-explosive, has a specific antidote, compatible with pre-anesthetic and other ancillary therapeutics, non-irritating and free from disagreeable odor, rapidly excreted from body with little or no tissue residue, not react with rubber tubing or soda lime. So basically there are two types of general anesthetic. First, inhale, and secondly, intravenous. Inhalation anesthetic are used for surgery. It allows precise and quick control of the depth of anesthesia. Most inhalation anesthetics are liquids at room temperature. Liquid anesthetics are volatile. They evaporate when exposed to air, changing into gas form. Liquid anesthetics require a vaporizer, which is a device that changes the liquid to a gas. As a gas anesthetic are combined with oxygen, they usually enter the patient body through a mask or tube. Inhaler Inhaled gases are used primarily for maintenance of anesthesia after administration of an intravenous agent. Change of IV concentration will change the depth of anesthesia. So, this figure shows how the volatile anesthetic will be delivered to the patient. In summary, volatile anesthetic will be delivered to the patient as it absorbed via the lungs into the systemic circulation and causing dose-dependent CNS depression. Inhalation anesthetic work by depressing the CNS. The effects of inhalation anesthetics on the CNS are loss of consciousness, loss of responsiveness to sensory stimulation, and also will cause muscle relaxation. The inhalation anesthetic drugs move from the lungs into the blood. The blood will distribute the drug to other tissue. The drug will be distributed most rapidly to organs with high blood flow, such as the brain, liver, kidneys, and also heart. Inhalation anesthetic are mainly eliminated from the body by lungs. Some inhalation anesthetic are also eliminated by the liver, and metabolites are excreted in the urine. Inhalation anesthetic are contraindicated in the patient with a known hypersensitivity to the drug, a liver disorder, or malignant hyperthermia, which is a potentially fatal complication of anesthesia characterized by muscle rigidity and high fever. Inhalation anesthetic may interact with other drugs that affect the cardiac, respiratory, or central nervous systems. These interactions may result in the following reaction. First, CNS depression, cardiac arrhythmias, and depressed respiration. Some inhalation anesthetics increase the effect of non-depolarizing relaxants. I would like to share with all of you the most common features of inhalation anesthetics. Modern inhalation anesthetics are non-flammable, non-explosive agents including nitrous oxide and volatile halogenated hydrocarbon. These agents decrease cerebrovascular resistance, which resulting in increased brain perfusion. They cause bronchodilation, but also decrease both spontaneous ventilation and hypoxic pulmonary vasoconstriction, which increase pulmonary vascular resistance in purely aerated region of the lungs, redirecting blood flows to more oxygenated regions. Movement of these agents from lungs to various body compartments depends upon their solubility in blood and tissue as well as on blood flow. This factor plays a role in induction and recovery. Now, let's move to the mechanism of action for general anesthetic. No specific receptor has been identified as the locus of general anesthetic action. A variety of molecular mechanisms may contribute to the activity of general anesthetics. At clinically effective concentrations, general anesthetics increase the sensitivity of gamma-aminobutyric acid, or also known as GABA-A receptors, to the inhibitory neurotransmitters, GABA. This increases chloride ion influx and hyperpolarizations of neurons. Post-synaptic neuronal excitability and thus CNS activity are diminished. Nitrous oxide and ketamine do not have action on GABA-A receptor. Their effects are likely mediated via inhibition of the N-methyl D-aspartate NMDA receptors. Other receptors are also affected by volatile anesthetics. For example, the activity of inhibitory glycine receptors on the spinal motor neurons increase. In addition, inhalation anesthetic block excitatory inhalation anesthetics block excitatory postsynaptic current nicotinic receptors. So I would like to share with all of you the comparison between the comparison of the membrane channel with anesthetics or no anesthetics. So this is the normal condition of the membrane channel. And this figure shows what happened to the membrane channel in presence of inhaled anesthetics. So I would like to stress that general anesthetics will increase the sensitivity of the GABA A receptors to the inhibitory neurotransmitters GABA. This increases the chloride ion influx and hyperpolarization of the neurons. So postsynaptic neuronal excitability and thus CNS activity. So in summary, general anesthesia is a powerful tool for providing patients with safe and effective pain relief during surgical procedures. Its mechanism of action is complex and it involves targeting specific neurotransmitters receptors in the central nervous system or CNS. In the next part of this presentation, we will explore the specific types of anesthetic agents used in general anesthesia and their effects on patients' physiology. That's all from me. Bye.